The CDC says it is monitoring a new COVID-19 variant, KP2, also known as the FLiRT variant, is a mutation of the Omicron strain. The CDC says as of early May, it accounts for 28% of all infections. However, the agency added it doesn't see any evidence that KP2 causes more severe illnesses than other variants, and it's also not causing an increase in infections at this time. For more, we want to bring in Professor Amira Roess. She teaches global health and epidemiology at George Mason University. Great to have you with us. So first of all, just what do we know about this variant? And a lot of people are just wondering, are we still in a pandemic?
Yeah, so this variant is what we call a descendant of one of the Omicron variants that was really dominant in the winter. So the KP2 and the KP1.1, those are the current, what we call FLiRT variants. They are expected to increase. What we are seeing so far is that the KP2 is making up about 28% of current variants, and the KP1.1 is making up 7%. Whether or not we're still in a pandemic, different people will tell you different opinions. Certainly we have come out of the worst of it. Right now, we are in a lull. We're not seeing that many cases. And also hospitalizations due to COVID have dramatically decreased since the beginning of the pandemic.
Well, past summers have seen waves of COVID cases. What does this variant mean for the summer, and why is it called a FLiRT variant?
Yeah, so the FLiRT variant is really based on some of the technical names that we give for the mutations and where those mutations are occurring. Certainly, it's easier to remember FLiRT than KP2 and KP1.1, right? So that's part of the reason why we're calling it FLiRT. Now, in the past summer and the summer before that, we have seen some waves of COVID, but they're not as bad as they were in the past, meaning that they're not as high as we've seen in the past, and also not as severe. The individuals that tend to have severe infection are really those who are immune compromised, who are elderly. So yes, we may see a surge, but it's nothing like what we had seen in the beginning of the pandemic.
Okay, good to know. There's now a question, of course, about vaccines and getting updated COVID boosters. When should people do that? And are they making any progress in terms of trying to reduce the side effects from the vaccine?
Yeah, all great questions. So a few things, right? What we're seeing right now is that these variants that are circulating, they are better at evading the immune system, right? The immunity that a lot of us have gotten from being infected by the Omicron variant, for example, or the immunity we got from the vaccines is not as strong against these new FLiRT vaccines. So the CDC is keeping an eye on this, and there is more work that needs to be done to really try to answer, how susceptible are the majority of us to getting infected. Now, that being said, for the majority of us, if we do get infected with these FLiRT variants, it is likely that it's not going to be that severe of an illness because a lot of us have some immunity. And as the viruses mutate over time, they do tend to cause less severe illness. Regarding the vaccine, it's likely that we will see an updated vaccine later this year, possibly in the fall, and more information to come. There is some work being done to try to improve the vaccine so that it is more effective against the newly circulating strains while also continuing to be safe.
All right, Amira Roess, thank you.
Yeah, thank you.